society of how do we avoid criminalizing our homeless. We've just heard the challenge we have with respect to veterans and our justice system. I'm haunted by a reflection by a documentary that James Gandolfini created called War Torn 1861 to 2010 that really reflected the rank injustice of criminalization for people who are ending up in our justice system not because of any criminal animus born out of greed, malice, lust, jealousy, bias, prejudice, hatred, resulting in murder, rape, theft, or other criminal activity, but rather act out because they've been traumatized through the wounds of war, they're mentally afflicted, they've been dehumanized through poverty, or they have addictive disorders that cause them to act out in ways that admire them in our criminal justice system. Our panel today is going to discuss ways that we can help extricate them from the justice system, but also help do everything we can to humanize their situation so we don't end up demonizing our most vulnerable in our community. And in terms of the efforts that we're trying to make in that regard, I often think of how the times have changed in terms of homelessness as it was when I grew up versus homelessness as it has evolved in the modern era. I'll share a quick story, the theme of which is how the times have changed. My wife, Denise, is a family physician at UCLA and takes both of my sons, David and Leo, to female family physicians. When David was about 4 or 5, she said, "So David, have you thought about what you'd like to be when you get older?" And he said, "I want to be a lawyer like Daddy." And she was kind of hurt. "Don't you want to be a doctor like Mommy?" He goes, "A male doctor? No." How the times have changed, in many ways for the better. But when I grew up in Los Angeles, I never saw a homeless person. The word homeless was not in my vocabulary. We were just discussing this yesterday with some folks in AOC, how I remember seeing a sitcom. It was called "A Homeless Man Comes to Thanksgiving Dinner," Good Times or Early Times, 1973. And I thought, well, I have to see how homelessness was presented back in 73 because I just have no recollection. Well, it turns out it was not about a homeless person as described by, as Judge Barranco was describing, living actually on the streets. It was about an elderly man living in a senior living center who had no family. He had no one to celebrate Thanksgiving with, which is often the darker side of homelessness. And it was a story about how this young man befriended him, engaged him, and brought him over for Thanksgiving dinner. It was incredibly poignant. But it showed how in one generation, how different homelessness was projected versus what we're seeing now with the unbelievable number of people in our streets. I just saw an article about San Francisco homelessness where they estimate about 7,000 people are homeless living on the streets of San Francisco as we speak. In any event, let's start the discussion more broadly in terms of, well, what does it mean to criminalize the homeless? I'm going to turn to Jeremy Rosen, who's been a true leader in helping decriminalize homelessness for the ABA.
Thank you and good morning. My name is Jeremy Rosen. I'm an attorney and policy director of the National Law Center on Homelessness and Poverty in Washington, D.C. I appreciate the opportunity to be here today. I think we'll have an excellent panel, including a number of folks who will be able to talk, I think, in a lot more detail about things that are going on here in the Bay Area and throughout the state. I want to just start off by talking a little bit more broadly about the issue of criminalization and, of course, moving us beyond our first panel that was on veterans issues. While veterans certainly are a significant proportion of the street homeless population, they certainly don't make up that entire population. And as we look at the population of folks who are involved in the criminal justice system and who are homeless, again, many of them are veterans, but certainly not all, or perhaps even most. When we think of criminalization, we're really talking about work by police and by the criminal justice system to essentially try to solve the problem of homelessness, often in a downtown community, through use of the criminal justice system. So we're talking about police practices that often involve citations, city councils passing laws around sleeping in public, around sleeping in public parks or other public locations, use of laws that theoretically apply to everyone, but in practicality are really only enforced against people who are homeless. Laws against jaywalking, loitering, used to cite people who are homeless, often to arrest them, to engage them with the criminal justice system. The Law Center really focuses our work across the country on looking at this from several different perspectives. Really, as I like to talk about it, sort of hitting people with the head and the heart. First, from the heart, the question of whether, as a matter of civil and human rights, this is the right way to be treating people who are living outside, as opposed to providing them with housing and other services. And really, secondarily, with the head, the criminal justice approach to homelessness doesn't work. Communities that have tried to arrest themselves out of homelessness instead really find people going through the vicious cycle, living on the street, being arrested, being engaged with the criminal justice system, having those interactions impose very, very significant costs on the criminal justice system. And then what happens is, folks in the city who think that the problem has been solved find that people leave jail, go right back to the street, right back to the same place that they've been. The problem hasn't been solved. There's been a lot of time, money, and effort spent, and folks are right back where they started, and then the cycle repeats itself. More money is spent, more time is spent, more people are frustrated, and communities still haven't ended homelessness. So really, from both perspectives, the criminal justice approach doesn't work, and I think we're going to talk to you today about approaches that would work.
Jennifer, you've been working on homeless issues for close to 20 years now. Has there been any evolution you can describe in terms of, when did this criminalization movement begin, and how are we doing in terms of helping to try and decriminalize the homeless?
Yeah, thank you. Good morning, everyone. Thanks for having me. So, one of the things I think that happens as we kind of step back and look at this issue of criminalization, it's important to remember why we have so many people who are experiencing homelessness in the United States. And it comes back almost 3 decades, where we really stepped back from our commitment in ensuring we had a social safety net in the United States, and deconstructed a lot of the advances that we made through the New Deal, after the Great Depression. And so one of the huge things that happened starting in 1978, but reaching its lowest point in 1983, was we cut our federal housing budget by over 74%. And at the same time, we made really significant cuts to pretty much every other area of our social safety net. And we found in the early 1980s that over 1 million men, women, and children were suddenly experiencing homelessness. And when you fast forward to today, it's almost as if in popular mythology that 1 million men, women, and children thought, wouldn't it be cool to live outside? Wouldn't we love to just leave our comfy beds and sleep on the hard concrete, and how wonderful that would be? And obviously that's not, and it's not a choice that people make. But what we've seen over time, as the federal government has refused to address this problem in a real way, we haven't reinvested in housing in any significant way. We've continued to make cuts to housing, in fact, and we've also continued to cut pretty much every other area of our social safety net. We've cut at the state level significantly and at the federal level, and I could probably talk for about 2 hours and not cover all the cuts. So what does that leave our local governments with? Well, it leaves our local governments with a really significant issue that they frankly don't have the resources to address. So there comes the development of the popular mythology, because what is the local government to do? Well, what do they have? What do they do have resources? They have police. That's what they have. So they utilize the police to manage the population, to move them from centers of commerce, to move them out of tourist areas, to try to, do all this kind of stuff. And the result has been really devastating, because in the end, the local government is spending a lot more money We're spending about $1,000 a day in San Francisco. You know, when somebody goes to San Francisco emergency room, it costs the city about $1,000. Okay, when they end up, when a human being's living outside, they're going to be ending up in the emergency room a lot, because human beings are not meant to live outdoors. We do not have protection on our skin. We need to live indoors. So it's really, really difficult for folks. So in San Francisco, this has been very similar to other areas. And as we've done this, just about every mayoral campaign, current mayor excluded, has really focused on the issue of homelessness. And it's done it in a way of scapegoating homeless people. And one of the ways that we've done that is really promoted this popular mythology that people are coming from elsewhere to enjoy our great services, that there's great weather, and that's why homeless people are coming to certain areas. And that creates a real political opening for the politicians to then get popular support for criminalization efforts. We've had over 7 ballot initiatives that have passed in San Francisco that have negatively targeted homeless people, that have vilified them, that have added to this criminalization efforts. Homeless people in San Francisco receive between 11,000 and 17,000 citations every year. Citations they can't pay, citations that go to warrant, that create a barrier to housing, a barrier to getting all the other stuff in place that they need in order to exit homelessness. And yet the data demonstrates that this simply isn't true. There's been so many studies. There was Las Vegas thought homeless people were coming to them in the winter because of the mild weather. You talk to people in Las Vegas and they'll tell you, oh yeah, homeless people come here in the winter. Not true. The data they did a very extensive study there, demonstrated not true. We've had studies in each of our cities, and they don't show that the magnet theory is true, and yet it's still kind of popularized, and yet our government officials are constantly repeating it, that people are coming and that people are choosing to be homeless and all this stuff, and it's just not the case. People are not. At our organization, we do outreach. We contact people. We probably talk to about 200 to 300 homeless people every week, and we've been doing it for 25 years. We've never come across anybody who is actually choosing to be homeless, who, if we're offered a safe and decent place to live, that they wouldn't do it immediately, unless there was a medical reason that they couldn't do it. And those are very rare situations. Someone with really severe form of PTSD that has a very difficult time being surrounded by walls. But that is not the rule. That is a very rare exception. And so these are the mythologies that have promoted criminalization. The impact has been devastating. We have a large proportion of our jail at any one time of people who are there that are homeless, that are basically there because they're too poor to afford a place to live. And we've got to stop doing this. We've got to stop bringing people who, because they're poor, that somehow they're getting dragged into our criminal justice system.
Bevan?
Thank you.
Jennifer raised a critical point about the inherent irrationality in how we're dealing with homelessness. It's been, I think, 8 or 9 years now since the $1 Million Murray article exposed how the costs of treating people on the streets versus housing them are dramatically more expensive. And yet we don't seem to have learned. How do you explain that?
Well, I don't know that we haven't learned, and I hope you noted that Jennifer tapped me. She didn't smack me when she made her reference. It was a loving tap. I think that San Francisco is on the cusp of doing things differently. And the job growth in San Francisco, which our mayor, who I work for, is rightly proud of, we have the largest job growth of any city in the United States. Our actual job growth in San Francisco is higher than that of 46 states in the country. So it's difficult to argue that there isn't a dividend at this moment in time that can be invested. And I think that I see my role as partnering with the Coalition on Homelessness and providers to say that we know that it's financially sound. I am a fiscal conservative. I think that we should house people. I think that we should remove as many barriers as possible. If there's one thing I've been profoundly unsuccessful in doing in the past 2 years, it's opening up wet housing similar to that you find in Seattle or Vancouver. And I've been advocating for it for almost 4 years now. And the public is for it, but in this job, it's very different. I worked for politicians all my life, and then I became one. And so I tried to enjoy those 8 years and to do things, and I can definitely tell you, I wish I knew now back then. because I would have been a lot less nice. I am a lot less nice in this job than I was as a supervisor, because guess what? I can't give out a proclamation and put somebody in a house. And so I want to share a young woman, Hillary, and I'm proud of the fact that we worked together in last year's budget, and in 5 months' time, we put together our first building for 18 to 24-year-olds, really focusing on the fact that we did, you referred to 7,000, so 6,436 is our homeless count. 3,400 are living on the streets of San Francisco. We did a youth count of 915, and this building comes along, and this young woman, Hillary, was referred by the Homeless Youth Alliance in the Haight-Ashbury. And she applied, and then as we got closer, learned that she had almost a year before been cited in the park, at Golden Gate Park, for selling $20 worth of marijuana. And she was afraid to go to the courts. This young woman she became homeless at 15 when her mother died, and she's now 23. And then, because she had no income, no food stamps, no GA, no nothing, she's been living in the park for 3.5 years, she picked up another $20 dealing citation. And because I was pretty popular, I get along well, I know a lot of people in this town, I thought that I could walk in and clear this up. It seemed ridiculous. She's been accepted into housing. Her life is going to change dramatically. And I walked into the Hall of Justice, and I hit a buzzsaw in the DA's office. A DA that I endorsed when he ran for district attorney, a DA who is frequently in the paper talking about this failed war on drugs. But his staff insisted that she had to receive a felony for these 2 minor offenses because she had gotten a stay away and a failure to appear from the first one. And I was devastated. And we were in court. You know, I went up to the DA's office, I went back downstairs, and we wound up having to accept a Back on Track program, which is a year-long program that to clear your record. So it's great that you could clear your record, but guess what? In the first 6 weeks that she entered this program, she had to do 60 hours of volunteer service. She's living in Golden Gate Park. I looked at them and said, what is she going to do? Garden where she's sleeping at night? I mean, what sort of volunteer service is it possible to do? I went to all of her meetings with her, all of her orientations. We went to an orientation at Goodwill where we spent an hour where every stupid PowerPoint that went up on the wall told her all the consequences of her failing at Back on Track. And when they turned on the lights in that room, and they only had her in the room with me because they didn't want me to see other people participating in this program, she started crying. And I was near tears. I was so angry about how this situation was. And you know what? One of Kamala Harris's staff people was there because she started Back on Track and she's looking at taking it statewide. And I was so angry that I didn't want to deal with anybody. But this woman said, you know, I wish I could do something to help you. And I just thought it was the usual BS that you hear from people. And I said, good, fine, here's my card. And 2 days later, this attorney sent a prepaid cell phone for Hillary because I had no way to reach her. I just had to work things on the fly. So I tend to talk about people as real people because when you see the people that are caught up in this system, and guess what? The department that ran this housing did not consult me on the rules, even though I was the one that got the funding put together for this thing, and the requirement was that you had to have income to move into this housing. How ridiculous is it? Do you know how difficult it is to get on GA? How many appointments you have to have, how you have to wait? Why is it that we couldn't move people in and then connect them with benefits? So I guess I can speak from the personal and tell you that, you know, this is not some theory for me. This is something I experience every day. The work we have to do, getting people with stupid infractions and warrants lifted from their record so that they can move into public housing that's probably not so great to start out with.
I think Bevan's touched on a theme that's universal in this program. Is
If he was straight, I'd ask him to marry me.
She's safe.
if only we had humanity in all of our politicians. But to humanize institutions and humanizing DAs, I see Judge Wendy Lindley, who started her career as DA here, who's done more to humanize our justice system than any person I personally have met. But in terms of putting a human face on homelessness and looking at the scale of who are we talking about when we're talking about the street homeless?
So,
Elaine?
thanks for asking that question. And can you hear me? Okay. So I did a little looking on the data. Is there anyone here in the audience outside of the state of California? Okay, good, a couple. So I have some national data, but it's mostly state of California data. So the 2013 point in time count, so on a night in January in 2013, 610,000 people were homeless. 35% of them were unsheltered. That meant they were living in abandoned buildings, in freeway underpasses, or automobiles, or other places not meant, or parks, other places not meant for human habitation. 35%. In California, we have over 136,000 people. 91,000 of those are unsheltered. 66%, 2/3, nearly double the national rate. So some might argue that people are homeless in California because of the weather, or they sleep outside because of the weather. They're sleeping outside because we don't have a commitment to housing people or sheltering people. There are other communities in the nation that have commitments to a right to shelter, some form of roof over your head. We do not have that in California. Consequently, we have the highest unsheltered rate in the nation. So, and then in my county, Alameda County, in the East Bay, Oakland and Berkeley, and Fremont and all the other amazing cities in Alameda County, lest anyone's from one of those and I've offended you, because I love you all. 4,200 homeless folks, and 2,300 of them unsheltered. Our unsheltered rate's a little lower than the state average at 55%. And a good portion of the people who are homeless are what's called chronically homeless, meaning they've been homeless for a year or more or multiple times in a number of years, and they have a disabling condition, often mental illness, often double disabling conditions, including mental illness or substance abuse, but also and most frequently chronic health conditions. So these are the folks that are getting citations that they then have to navigate in order to resolve to get housing. So our sickest, most vulnerable people are the ones subjected to the criminalization of homelessness. Now I'm going to ask you all a few legal questions. Who used the bathroom this morning? Who? Okay, glad to see that. I feel better about your health. Who took a shower or washed up in some kind of way? And I'm not trying to like out anybody in the last 24 hours. Okay, and who ate a meal? And where did you do those things? Where did you do them? Indoors, and certainly probably most of them. And who changed your clothes? Who changed their clothes? Actually, I've been wearing this blue suit for 3 days. But it still looks good. It's wrinkle-free. Okay, so we all changed our clothes, right? And you did that in the privacy of your own home. Some of you may have changed in front of others, but we won't ask you that question. But the point is, I'm trying to get you in touch with the very basic human things that we all have to do. We need to do them somewhere. Somewhere. And people are getting citations for using the bathroom or trying to clean themselves in public places. A woman who sits on my board spent 10 years on the streets of Berkeley and said to me, home is a human necessity, and if you can't make home in 4 walls and a roof, you need to make it somewhere, because you have to eat, you have to toilet, you have to wash, you have to change your clothes. Those are human needs that we are criminalizing in some communities. People cannot stand up and move constantly. They have to lay down and sleep somewhere. Judge Barenko mentioned seeing all the homeless people inside the BART station. I walked by a person whom I couldn't see, because they were completely covered in a thin sheet of orange plastic, lying on a low wall about this high, with all their stuff and their bike tied to them, trying to sleep in the pouring rain. People have to lay down. They have to eat. And we're making those activities criminal. And one of the reasons I think we are making them criminal is because nobody wants to live in a community that would let human beings live that way. It's a source of shame for us. That's not what we want. But the reality is that every community generates its own homelessness in this country right now. So in where I live in Alameda County, there's a city called Piedmont, and Piedmont is where all the rich people, or that's what we say. And you know, when we do our HMIS, our Homeless Management Information System, there are people who use homeless services in our county whose last permanent address was Piedmont. People lose housing in every community, and they often stay in the communities. Our data, too, does not support that people travel. Right now, the city of Livermore just passed an anti-camping ordinance because one of the narratives was everyone is coming from Oakland to be homeless in Livermore. So you all may not know our county very well, but Livermore is like 25 miles east over the hills from Oakland, and at least 3 hours of bus rides with, you know, no overnight shelters. So it just doesn't, it defies logic that when people would say, geez, I lost my housing, let me get on 3 buses to go to Livermore and be homeless. It's just, so, and the other myth I just want to bust with my remarks, and again, by inviting you to think about your own lives, is this idea that people want to be homeless. And that you hear people, and that people get offered a place to stay, and they turn it down. So I want to ask you, who in this room was told what time lights out in their home last night?
What time lights out? Like when you have to go to bed?
Yeah, like what time it's got to be dark and quiet in your house? Nobody? Okay.
I have a 7-year-old. It's chaos 24 hours. Yeah.
You
Maybe
want to
tell
tell
her to
the
go to bed.
7-year-old one, but actually, in some ways, that's my point.
Yeah.
A 7-year-old, it's appropriate to say lights out, time to be quiet. But we're all adults in this room, and no one told you what time you had to turn your lights out and go to sleep. Who had a glass of wine or beer with dinner right after work last night? Okay, same. All right. And was there anybody to tell you you could or couldn't?
My wife.
Someone might have poured it for you if you were lucky. Right? Or chew gum. Or does anyone snack in watching TV in their bed at night? Like I do that. I take food back into my room. I shouldn't, I know, for my health. But these are all personal choices about when we eat, when we sleep, if we like to shower in the morning or the evening, if we do our laundry and leave the wet load overnight and dry it in the morning. Those are all things we get to choose because we're grown. And when you move into a shelter, none of that you get to choose, pretty much. You often don't get to decide what you eat, when you eat, with whom you eat, what time you go to sleep, what time you can watch television. So there are people who, when you ask them if you want to go to a shelter, they say no. You might say no too. And I ran shelters for years, so I'm not trying to trash shelters. It's a very difficult setting when you're housing a lot of people. In a shelter, you do need to create some standardization. But we sometimes translate, I don't want to go into a shelter. I can't take my dog. I can't control my stuff. I have special eating requirements that won't be accommodated, to I don't want housing. But if people are offered the opportunity to live where they have their own key, they can come and go as they want, they can eat, shower, watch TV as they want, we almost never hear somebody say no. And so, you know, if I could leave you with anything, it would be to bust that myth that people want to be homeless. What they don't want is other people bossing up their entire lives. And that's, in my mind, somewhat reasonable.
We do have a phenomenon quite different now, that and as somebody who's looked at this issue for about 30 years now, it used to be a situation where there were 3 words to response to how do we solve homelessness, and those words were housing, housing, housing. We now know it's far more complex given the untreated mental illness that we see on our streets, addictive disorders that are untreated, people who, for whatever reason, have adapted to living on the streets, and they ultimately end up being criminalized where they're further dehumanized, further estranged, further alienated, further disadvantaged in terms of being integrated into our society again. Well, are we making progress in helping decriminalize our most vulnerable and needy members of our community? Are we seeing progress?
I would say from a programmatic standpoint, I think that there are a lot better programs. We have rapid rehousing. We're making enormous strides in San Francisco as a result of the VASH, the VA, and HUD commitment. So veterans homelessness was 18% of our homeless population 2 years ago. It's down to 11%. We have a veterans court now, which is doing things. But I think that the tendencies that Jennifer speaks about, unfortunately, are there because I think that people in elective office don't know what to do, and so they become reactive. And to Elaine's analogy about the judge sharing about people being in the BART station, well, guess why? Because 2 years ago we passed something called sit and lie, which makes it illegal to be sitting or lying on the sidewalk during the day. It doesn't apply to the BART stations. So no wonder people are down there, right? I mean, this whole notion that somehow you can legislate away poverty by imposing sanctions on people, and now there are significantly more people at the daytime and at night that are in the BART muni stations, and I'm working with, service providers, and I understand that the police have problems. And I'll tell you, most cops that deal with this stuff, they'd much rather house people, frankly. Yes. He's off on Fridays, but Dennis Cicina's a guy that's the cop at Civic Center. He's awesome. I mean, when I first took this job, there was a huge growth of people who were in the plaza. I went to the health director and said, can we get 20 stabilization rooms? She said, I'll give you 10, and if you fill those, you can get 10 more. Well, guess who filled 14 of them for me was the beat cop. And he was so excited. He was excited because he got 2 people in one unit because they were a couple. And that speaks to Elaine's point. You can't go in a shelter as a male and female couple. You can't be together. You can't take your dog. Dog gets crated on another floor. You've got a shopping cart full of possessions. You're not going to be able to fit that into a drawer under your bed. So a lot of things just don't work. So I think from a programmatic standpoint, all we need are more resources. We absolutely know what's necessary to house people, and I would beg to differ. You give me anybody with any condition, you give me housing, we can make it work. And so I'm about the 4th grade solution. You know what a kid would say? Homeless people need housing. I don't think it gets any more complicated than that. And in San Francisco, we have a significant amount of SRO stock that is not being occupied, not on the market right now. And I think as a city, if we aggressively go after that, tie that stock up, and figure out, what we need to do to house people. I mean, that doesn't solve family homelessness. I understand for young people, they may not want to be in the TL, but at least it enables us to dramatically go in and improve that housing stock where, we've master leased it. I think that's another thing. The SROs were not traditionally very good 20 years ago, and we've got providers like DISH and other organizations that do an amazing job of functioning in very difficult neighborhoods and providing safe housing. So I think programmatically we absolutely know what to do, and I think that the politicians. So my successor passed a law to ban sleeping in the park. It's very frustrating to me because guess what? I work with a lot of LGBT people that live in the park because they feel safer there than they do in shelter. So I understand his desire to make constituents happy and not have people sleeping in the park, but don't pass that and not provide some resources for housing. I just think that, that's what people have to be called on, is you cannot impose these sanctions to criminalize and somehow make poor people and homeless people disappear and not be accountable to put some housing on the table and make it happen.
And that's something actually we have done a couple, not on the scale we need to, but in Alameda County, we had 2 strategies. One, the public commons for everyone strategy in the city of Berkeley, where there was an effort to make community areas free of folks living outdoors, but they raised the parking meter fees and used that to fund permanent supportive housing subsidies. So when you were saying to someone you need to clear out, and you could clear out to an apartment, how's that sound? And we did the same we had an encampment in front of the county seat at 1221 Oak, and the General Services Office came to us and said, we need to get this cleared out. And I said, well, let's clear it out by creating some housing for folks so that there's an alternative. And we got Section 8 vouchers from the federal government. And so in asking people to move along, we were also saying there is another alternative. So it is reasonable not to want communities that are have people camping in public buildings, but the commitment you need to make is not to criminalize them, but to house them and have the resources.
And also finding right strategies. We have seen, I mean, at least in LA, cases where people have been offered housing and have, despite extensive outreach, and for whatever reason, I think they're usually their mental wherewithal is they're fearful of that environment. Steve Lopez had a wonderful story about his journey with Nathaniel, a famous musician who went to school with Jojo Ma, and he had to set aside an apartment for 6 months before he was able to get him incentivized to go into it because of his paranoia. But criminalization has other impacts. I mean, in terms of confounding our efforts to permanently house people, it dehumanizes them to the point of not being able to vote. If you have a felony, you often don't qualify for federal subsidies. And I think the United States has really attracted kind of the ire of the international community. And Jeremy, you've had recent exposure to that. Do you mind just summarize your recent field trip?
Sure. So at the Law Center, we really focus on this issue as both a civil rights issue and a human rights issue. And to that end, we actually do some work with the UN and other international institutions. The privilege recently of spending a week in Geneva at the United Nations, talking to the members of the UN Human Rights Committee as part of an international treaty review of U.S. government compliance with a treaty called the International Covenant on Civil and Political Rights. I was very much struck that at a session where international observers raised a lot of concerns about a number of things that happen here in the U.S., many of which are more high profile, though I would argue no more important than criminalization of homelessness, including U.S. government activities that could be considered torture overseas, NSA spying, the death penalty, many other issues. The head of the Human Rights Committee, in delivering his summary at the end of the session, said that he was as shocked, if not more shocked, by the fact that in this country with so many resources, not only did we have so many people who were homeless, but that instead of actually providing them with assistance, we punished them through the criminal justice system. And in fact, there's very specific language in international law when a behavior is referred to as cruel, inhuman, and degrading treatment. This is normally language that's used to talk about torture and all kinds of shocking activities of that nature. And the UN Human Rights Committee, in its report, as they saw some of the evidence and other things that we presented about criminalization in this country, they've actually referred in their report to criminalization as cruel, inhuman, and degrading treatment under international standards of law. I think that's very important and really sets the tone for a lot of our domestic advocacy on this issue. And many of my colleagues have done a fantastic job on the panel of really humanizing the issue, and this just continues it. This is about people, it's about ourselves, how we want to be treated, and how we can treat others with the same standards and the same respect, and do it in a way that allows us, I think, to meet everybody's needs, because as I think Elaine just mentioned, it is extremely reasonable to say that we do not want to see people camping out in public spaces or want to see people in the BART station. The question is, what are we going to do to solve the problem? Are we going to find responsible solutions that help everybody, including often the downtown business community, a group which is often in many cities behind criminalization efforts that we haven't talked that much about so far? There are a number of cities where the business community has realized that these solutions, housing people, works. The criminal justice approach doesn't work because a store owner who wishes that a homeless person was not sleeping in their doorway may first say to the police, "Why don't you arrest this guy for sleeping in public?" And sure enough, that person is gone for a couple of days, and then the person is back. Eventually they see that that doesn't work, And hopefully, and this has happened in some places, we've gotten people to become a bit more enlightened, and so they're willing to support these alternative solutions that are win-win solutions for everybody. People get housing. The downtown business community doesn't see homeless people sleeping outdoors, and everybody's better off.
I was told to allow more time for questions. We have about 15 minutes left. Eileen, do you want to add something before we turn over to questioning?
Oh, I just wanted to add, Bevan had mentioned the Sit Lie campaign in San Francisco, and that was something that was mostly funded by the financial industry, and some would argue to try to get a more conservative elected in his previous seat. And homeless people are often used in this way, in a scapegoating manner. But in this situation, I think it's a really good case study, because what it did is it there was a lot of focus on the Haight-Ashbury area of the city, and the merchants in this process, who presumably were going to benefit from the passage of Sit Lie, really lost. And they lost because there couldn't have been a worse PR campaign for shopping in that neighborhood. You just couldn't have dreamed up something worse. I mean, all these stories were being, and media and all this stuff made it seem like a very, very scary place to go. And in the end, the law passed. The merchants have not noticed a difference in terms of the presence of poor and homeless people. People have actually gone to trial. Many people have gone to trial by being prosecuted for the really crazy crime of sitting or lying on the sidewalk. And we've spent a whole lot of money on it. And hate crimes against homeless people were increased during that period, because there was we created such a atmosphere of intolerance and hatred. And so, everybody lost. Homeless people lost, the merchants lost, the neighbors lost. And in the end, there was a whole lot of money spent. The proponents of it spent almost $1 million on that campaign, by the way. And it didn't win by much, but wow, we could have dreamed up a lot better uses of that particular money. And we could have targeted the specific individuals in that neighborhood and done a whole lot more good. But that really wasn't the interest. It was the broader scapegoating. And so I think, we have a long ways to go, and I think we can all learn from that particular lesson.
I was really impressed. We were here, the ABA Commission on Homeless and Poverty was here about 5-6 years ago, and we met with a group of outreach workers who also engaged the police as partners to help prevent the criminalization of homelessness and help facilitate getting them into supportive housing. And at that time, they said within 48 hours, anyone who requested housing could probably get it. And I asked them more recently, and they said, no, that wouldn't be the case. And they said the political...
I'd be interested in meeting that person that told you that 5 years ago.
But I was impressed with how the police were very proactive, and I observed them interact with the homeless, and they're much more tolerant than I see the police, certainly in Los Angeles, in terms of letting situations diffuse. I don't know if you keep track of how many quality of life offenses are committed by the homeless, but...
Well, I think that the whole infraction process is broken. So, those are the parking ticket equivalent of somebody with blocking the sidewalk or aggressive panhandling, and it's just that nothing really happens with that. And so I think everybody has kind of moved on unofficially, and really all you can do with infractions are really to pepper somebody with them and then get them on failures to appear. So it really is just... That's where it is.
Well, there was one program that was called Care Is Not Cash, or Cash.
Care Not Cash.
Yeah.
So we'd probably differ a little bit. I did support it. It was, and I do believe in it. So Care Not Cash basically said if you were homeless and receiving GA, and I think the amazing thing, so this goes back 10 years, the amazing thing was that overwhelmingly people on GA had housing at $400 a month. I mean, that's pretty amazing to do even 10 years ago in San Francisco. But there was a subset that identified as homeless, and the feeling was that because they weren't on a path to housing, they would just get into an SRO for a little bit, maybe use, and just be in this revolving roller coaster, that instead someone would be given $59, but they would get a dedicated shelter bed, and then the Human Services Agency would put them on a direct or defined path of housing, which could take months, but they would have a dedicated shelter bed. And when the 10-year plan to end chronic homelessness the 10 years comes up this year, one of the goals was to develop 3,000 units of permanent supportive housing, and we've developed 2,800. So I think, given the recession, we've gotten a far way there. And I think that those early years of Care Not Cash, a number of people did leave the program for a variety of reasons who were getting the $59 benefit and the shelter bed. But we're at a stage where the biggest reduction in homelessness took place when we brought a significant amount of housing on, because we had baseline funding. You couldn't spend any less than you were currently spending on this population, but we moved it more towards master leasing, and that's kind of where I am, is this, we need more housing. It's very straightforward. People want a door, they want, a bathroom that's theirs. I mean, it's very straightforward, and we're right now in the concluding stages of getting a 136 unit residential hotel in the financial district, which is great. It's going to be for veterans, and we've had to fight really hard to get this building. So I would say I think those people lied to you, not that politicians don't lie, but and I think that that's where we're pushing so much. One of the things that came out of the 10-year plan was we want permanent housing, not shelters. And so we went from having 1,900 shelter beds in San Francisco now to having 1,145. And it's really complicated because on one hand, I understand you don't want to keep folks in shelters, but the first thing that I did when I went into this role, and Jennifer and I knew each other really well and we liked each other, but I think our relationship has really changed over the past 2+ years, was the first thing was that in San Francisco, if you want to get a 90-day shelter bed, you have to go to a resource center, and generally, like Glide, people are lining up at 2, 3, 4 in the morning. Sick people, old people, women, a lot of people, that's not something that they were going to do. And so the coalition said, well, you might have 70 people in line and only 5 90-day beds might drop that morning. And so all these people are left with nothing from waiting all night, and then they have to walk almost 2 miles to go to MSC South Shelter to get a wristband to prioritize for a 1-day bed, and then guess what? You got to walk 2 miles back to go to St. Anthony or Glide. So we had people on this pilgrimage, and we worked very painstakingly, and from the department standpoint, it was a lot longer and harder than it should have been, but now people can call 311. And it's really changed things. It's made the city focus on the fact who are long-term stayers, and many of those are people that were said, oh, they've rejected housing, but rejected housing to go on to 6th Street where they were afraid that they were going to live the rest of their lives on a very crime difficult block. And it's really sort of refocused things, and 57% of the people who are making reservations, you can still wait in line if you want to, but there's no benefit. It's not first come, first serve anymore. We lottery in like 2 to 3 day increments, and people can have a defined sense of when they're going to go in shelter. 57% of the people that are seeking to access shelter have cell phones now, so they can get a text message telling them whether they have a bed and where that bed is. And I think that that's where technology needs to come in, and things like Hand Up in San Francisco. If you've not visited handup.us, we have a for-profit business that is crowdfunding for homeless people, and it's been very transformative. We've been able to change a number of people's lives as a result of that application.
It's a great response to my question, but it occurred to me that when Amy said to allow 15 minutes for questions, she meant questions from the audience, not from me. So I remember this. Anyway, I'd like to turn over at this time. Yes.
I'm just curious how paying people to leave the Albany Bowl, how's that working, and is it really going to end those people's homelessness just to pay them to live where they've been living and where they consider their home facilities? Is it enough money for them to actually have a home indoors elsewhere?
Right, so you're referring to a settlement that some people have received. I think it was an individual amount of $3,000. Are you familiar with the amount?
Yeah.
Yeah. And it's an encampment of about 50 to 100 people, some of whom have lived out there for decades, and a significant proportion of whom are quite sick. And so living outdoors is really shortening their lifespan. So Albany Bulb is extremely complicated, and I'm not an expert on it. There are a number of challenges with that response, and if I were the one who got to say how the city of Albany dealt with the Albany Bulb, it would not be going down like it does. That said, Everyone Home, which serves as the homeless continuum of care organization in Alameda County, which I direct. I'm sorry I didn't introduce that earlier, advocated strongly for providing resources for people to exit the bulb and not just criminalize. And there have been outreach workers out there helping to house folks. I also want to speak to Bevan's point about, amazingly, the high portion of people on general assistance who are housed. One of our studies in Alameda County is that people leave our homeless system, 2/3 of them leave to unsubsidized housing. Some of it's returning, reconciling with friends or relatives, but a significant portion, about half of that 2/3, are going to market rate housing. They're renting a room and whatever. So I think we sometimes underestimate the scrappiness and resilience of people to resolve their problem and think that the only way to end homelessness is to give everyone a shelter, a Section 8 voucher, or permanent supportive housing for the rest of their lives. And that's not actually what's been true about people exiting homelessness. So I would say that $3,000 may surprise us. And for some people, it will definitely be inadequate. And people will need support to stabilize in the housing they locate. Many of the people on the bulb don't have benefits, but they're entitled to them. And so they could use support and there is benefit advocacy connected to what's going on. But the folks at the bulb have really deep mistrust of authority and public institutions. And I just heard a story the other day that was so disturbing and illustrative of our point. So they put a shelter out there, and they said that, and they've got meals and blankets, and they said you have to stay inside the building to get any food. So a woman with a health condition that required that she eat small meals frequently said to them, I want to stay in the shelter, I'm sick, but this is what I need around dietary requirements. And they said, well, our rules don't allow for you to have food near your bed, so you can't stay here. So she continued to stay outside, and then learned that only 2 or 3 of the beds in these modulars were occupied. So they had all this food, and so she went and asked for some food, and they said, well, we can't give it to people that aren't staying in the shelter. So then she asked, what are you going to do with all the extra food? And she said, oh, our outreach workers will give it to some homeless people. So, and you know, I don't know if every detail of that story is true, but it is sort of illustrative of how ridiculous sometimes our requirements are for people to get help. So I think the Albany bulb is doing some good things. I think $3,000 may go, I mean, it's a tough market, but people are remarkably resourceful if they've been surviving outside for 2 decades. So I think there's some good elements of it, and I think there's some extremely problematic elements to it.
Any more questions? Yes?
So I'd like to respond to it, if that's okay. She was She was asking about improving the conditions inside shelters and also speaking to the level of rules and difficulties that people face in shelter. And so, first, I just want to say, making one thing clear, shelters in San Francisco and it's pretty similar everywhere else are almost always full. I mean, the Albany bulb thing is kind of a strange situation, but typically our shelters are always full. That said, we have about one shelter bed for every 5 homeless people in San Francisco, as an example. That said, we've done a lot of work on trying to address this very issue. From a homeless person's perspective, it does feel very similar to a jail. And some of the larger shelters are run, just like a jail in the same way, where there's a lot of shouting by staff, telling people to get in line. There's, it's very cold. It's very, very rigid. And then, you have the smaller shelters that have, there's a lot more kind of love in the air, so to speak. So one of the things that we found in San Francisco is that several years ago is that there was some really severe problems in our publicly funded shelters. And actually, there's no standards by which shelters need to operate. And this is typical because we looked nationwide. So if you're in a jail, for example, there's certain standards around things that need to be provided, place institutions where elderly people live, regulations around how much space between beds, hospitals, all these other institutions, we have some level of licensing standards. And in shelters, we don't. And what we had in San Francisco shelters is we had oftentimes mats on the floor that were like this far apart. We had no toilet paper in our bathrooms. Sometimes newspaper on the floor, no soap to wash your hands, no warm water to do that, no fresh drinking water. So, when you kind of line this out and you look at it from a public health perspective, it's a total disaster. Because, what's the most common way to prevent communicable disease? It's to wash your hands with soap and water. You have 100 people in an enclosed space living that close, and you're not making sure that they at least have the opportunity to wash your hands. It's really a disgrace. And so we did a lot of work and did a consensus-based process and passed legislation to create standards of care in our shelters. Then we created a monitoring committee where folks go out and do announced and unannounced visits and make sure that the shelters are following the standards. And then we did a whole effort to increase the funding for the shelters because, part of the issue is that we really, we're funding our shelters with bare bones. We actually didn't even fund them enough in some of our shelters to have one staff person per floor on every shift. And, the city is funding it, giving the money to a nonprofit to run. The nonprofit carries the liability, but doesn't have enough staffing in place to really do that in a responsible way oftentimes. So we did that, and that's been really successful, and tried to address all those issues. So that's certainly one way to go about it. Another thing is, and I just want to mention, in Bevan, there was an encampment that was cleaned out, which, Coalition on Homelessness, we oppose that because we know there's no place for people to go. It was CHP, California Highway, Caltrans land. So it's like basically, the state's transportation corridor. It was going to be cleared out, and we, really worked together on stuff. And one of the things that happened is that they created a space that was very low threshold where people could bring all their belongings. They could bring their pets. They could stay with couples. There was a really close community that was living there, actually, and they could stay together as a community. And then efforts after that to house them in a way that they could stay connected to community. It was a much more deliberate and careful process. We still don't love it because it's an awkward way to prioritize resources, but it's a much better way to do things. But what it did is it got folks into housing that traditionally have been totally ignored, and
No one turned down housing.
and no one turned down housing. Everybody said
In
yes.
fact, I just got a call because one of the guys was driving with a friend to go to his stabilization room, and the friend got busted because the car was stolen, and he had a warrant, and he wound up going to jail. So I just heard, this is like 7-8 months ago, I just heard from his probation officer saying, you know, he missed out on that housing 7 months ago. And so, but everybody went, and I just want to say that despite some reservations, the coalition came out and brought coffee and pastries that morning, and it just reduced the tension that I've experienced when I've gone to these types of situations, because everybody knew that they were going to get housing within 56 hours. Everybody knew that they didn't have to get rid of anything, that DPW was going to move their possessions. And the bottom line is, when you look at municipal budgets, they never question how much we spend on street cleaning or police costs or court costs or jail costs. But this is the unproductive way we're spending this money. And the other message is, Congresswoman Jackie Spear spent a night in a shelter in San Mateo. And for those of you that interact with people in political office, ask them to do something like that. Ask them to stay in a shelter. Ask them to go and qualify for GA, to find out how difficult and how burdensome it is, and that's their homework assignment. You know, it's very difficult, and I think more people in office should have to function and navigate the system, and they'd understand why it's not working better.
It's my unkind task to call it in to watch the clock. However, I am an attorney with a captive audience, so I'm going to get the last word. I want to reflect on something Judge Stephen Manley, who you'll have the honor of seeing later today, said. He said that for this population, jail does not work, but I use jail therapeutically as a vehicle of engagement. And the most powerful story in my 20 years of public counsel that demonstrated the power of that approach was the first time I visited him in 2000. He had a woman who was graduating from his program who 2 years before had been living in cardboard boxes, using her children to panhandle for a drug addiction. She came before Judge Manley. He said, I don't want to put you in jail. I don't want to incarcerate you. I don't want to take away your children, but you need help. And if you accept that help, you don't have to worry about that. She said, screw you, Your Honor. You're not going to tell me how to live my goddamn life. Much more nasty than that. And most people say, well, she made a choice. She'll have to live with it. Well, not this judge. He began writing letters to her saying, I want you to know the door is always open, but your children need a parent making a better choice. And she wrote back hate mail, and he persisted. After 30 days, she finally accepted the help he offered. It's now 2 years later. She's there with her children with glowing report cards. She had 2 jobs. She was managing an apartment complex. She baked a cake for the judge. He brought toys down. This is a criminal court. He brought toys down from the bench. There's hugs and tears all around. He said, it wasn't always so good, was it, Miss So-and-so? And she said, no, Your Honor. As a matter of fact, when you put me in jail and took away my children because I wouldn't go into treatment, I hated you more than any human being I've ever met. And he's the one I got with the patch. He goes, I know, I still got your email to remind me. She said, but those 30 days you put me in jail, but you didn't give up on me, saved my life. 5 people said the exact same thing that one day in court. Your Honor, those 5 days you put me in jail, but you didn't give up on me. Your Honor, those 10 days you put me in jail, but you didn't give up on me. This whole panel has been about not giving up on our most vulnerable and needy members of our community. Judge Manley has 2,700 people on his docket he's keeping out of the criminal justice system through the same approach. In any event, thank you all very much, and keep the fire burning.